everyone, and welcome to today's session. My name is Jen, and I'm from Doctor on Call. In here with me is Dr. Thaneemalai,
Hi.
a consultant and an obstetrician and a gynecologist from
Okay.
Thompson Hospital.
Thank you.
Basically, he specializes in pregnancy and female reproductive health, which brings us to today's related and very interesting topic that we're going to talk about, which is menstruation or period, or what we always ladies say, always the time of the month. Yes, so we as a woman, we usually bleed 3 to 7 days. However, for some women, they tend to bleed more than 7 days, which this is actually called heavy menstrual periods. Doctor.
Hi, Jane. Nice to have
Welcome.
and educate everyone on this topic. This is a very important topic where women do suffer in silence. Most of them, they have menstrual periods, but they don't know what is right, what is wrong, and what is a normal consistency. And you go and seek help from the medical doctors as well. The doctors are often sometimes confused. Not proper treatment being instituted, not proper advice has been carried out. So generally because of that, you look at generally in the medical world, the consensus of what is normal period, what is abnormal period, they're not able to come to a conclusion. Most of them. And that's the reason everybody uses different terminologies, different timings, and was not very accurate. So of late, the medical community has come up, pulled its strengths together and come to an agreement to say that what is normal, what is abnormal, because they have come to an agreement. So let's look at what is normal. People last time they used the words menorrhagia or metrorrhagia. In the medical world, they've been using a lot of abnormal words, Latin words, and they found that we use those words are not very accurate to describe one person's problem. So we come up with use a simplified words we call heavy periods or heavy menstrual bleeding. So that results, we need to confirm the bleeding is because of pregnancy or any other reasons. And if it's not due to pregnancy, then we call it abnormal uterine bleeding. And we need to find out what's the reasons women have this bleeding. So technically, they come to an agreement, say that if any woman who bleeds more than 80 mils, then we say it's a heavy periods. It's very difficult, we can't quantify. Only for research purposes, we say it's 80 mils, but generally it is not unquantifiable. If for a layperson to use and quantify how much blood loss is very difficult. So you can't use that wording. So often it's extended. Let me explain to you a little bit on physiology and what is abnormal and what is normal. So women do suffer from excessive bleeding or severe cramps or pain and loss of work as well. They are unable to go to work and concentrate and require medications as well. So 1 in 5 women who suffer from this problem from age of 30 to 55 years. Sometimes women perceive these heavy periods, but it may not be heavy periods. For some women who feel that cycles are normal or periods are normal, but they do have abnormally heavy periods. So only 5% of women who seek medical advice from the doctors as such. So what do you mean by heavy periods is if one person uses one pad per hour for multiple hours, that is considered heavy. It's not normal. It means you change your pads once in every hour is not normal. Or you require to use double sanitary pads to control flow, or you frequently change during night, then we consider it's a little bit heavier. Or if you bleed more than 7 days, it's considered heavier. And if you pass out large clots, more like 50-cent coin clots, or more bigger than that, is considered as abnormal. Or if you have experienced fatigue, weakness, shortness of breath, then it's considered abnormal. It means underlying you are having lack of blood, it needs further investigations. So for people to know about it, and let me explain what is normal. This is the womb. We call it in layperson's words womb. This is the entrance of the womb, we call it cervix. And this is the ovary, and that's the fallopian tube. Every month, you must have studied in the school that women do have regular menstrual cycles, which is controlled by hormones. So I'm not going to go in detail. Let me recap a little bit on what is normal cycles. So, in average healthy adult woman can experience menstrual cycles from 28 days to 38 days. That's normal. But not necessary for a same person. You will have your cycles regularly on the dot like robot. It is not. The cycles differs due to our emotion changes, due to our body weight and our requirements. The menstrual cycle length changes that much. So this is controlled by hormones coming from the brain, base of the brain, called pituitary, which control this hormone to secrete in cycles. There are hormones, a follicle-stimulating hormone and luteinizing hormone, which is controlled in cyclical manner so that the woman is able to ovulate regularly in cycles. So this is the egg. Normally, women eggs are not produced often. Every individual is born with the eggs, and these eggs mature over time, and every 1 month, 1 or 2 egg matures and comes out during the cycle. And if it gets fertilized, that forms a baby. If not, woman gets a menstrual cycle. The lining of the uterus, we call it as endometrium, it sheds, and we call it as endometrium, which sheds, and the woman will get a menstrual periods. That's normal. So this is the the womb. Lining of the womb has the endometrium, which sheds and creates menstrual cycles. And the beginning phase, the lining of the womb grows. In the mid-cycle, it ovulates. So it prepares itself. So once you ovulate, this endometrium has this progesterone that we call it secretory phase, which prepares itself to receive the fertilized embryo. And baby gets attached to the endometrium. If a woman don't get pregnant, this endometrium, all the hormone values goes down, so you don't have any more hormones during the cycles. It sheds, come out from our periods. That's normal. This is the lining of the womb. We call endometrium. It grows. After 28 days, it sheds. For teaching purposes, we use 28 days. So that is controlled by hormones coming from the pituitary. FSH, LH makes the egg to grow, and the lining of the uterus to grow in length. After ovulation, if you don't get pregnant, it sheds. That's normal. So this is in 2015, most of the medical experts all around the world agreed to this consensus. This is what is considered as normal. First is frequency. How often a woman will get her menstrual cycles? If you get every less than 24 days or within less than 28 days, that means every individual should get within from 24 to 38 days, then we consider as normal periods. And the duration should be less than 8 days, within 3 to 7 days. Then regularity, that means every individual should get your periods, sometimes not on the dot, can be earlier than or later than that. That means the difference between from the earlier cycle or sometimes later menstrual cycle delay could be less than 8 days, should be less than 8 days, is considered normal. Then we quantify, we ask the woman that your period is heavy, normal, or light flow. That's why we quantify. Okay, so sometimes we for purposes to confirm, we use a menstrual chart. If the tampon is fully soaked, that means you consider very heavy. This is normal. So for personal hygiene, women do change menstrual pads very often. Sometimes a little bit when it's soaked, they change. It doesn't give an accurate answer to us whether the period is. You can't judge whether it's accurate or not. So that's the reason we use sometimes menstrual charts, menstrual pad charts. That gives us an answer. So usually we look at what are the causes. Common causes is sometimes majority of the periods are not regular. You don't get your periods every 38 days. If it gets more than 38 to 40 days once, then we call it as a ovulatory dysfunction. That means individuals don't ovulate regularly in the cycles. Or sometimes they have bleeding disorders. That means they can tend to have easily bruising, injury, they tend to bleed a lot. We need to check and see. Or sometimes they call this called adenomyosis or pelvic infection, or you get abnormal growths in the uterus, we call it fibroids. Or sometimes growth inside the endometrial lining, we call polyps, or you can get cervical cancer and ventral or endometrial cancer. All these are common causes when we get heavy periods. We need to confirm what is the reason. So All you need to do is how you need to go and see a gynecologist. Often people come and ask, say, can you scan and tell me what is my problem? So the science doesn't allow us, by looking at the scan, it doesn't give you all the answers saying that you're healthy. No, we need to do a proper examination and proper, we need to do a liquid-based cytology, examine your cervix to look for whether the presence of any cancer. So that's what we need to do, an examination, proper pelvic examination first, to look at your cervix, and you need to feel within your hands to check whether the womb is enlarged, or you have any problems in the womb, or you have any pain. So that gives us a clue. If it doesn't work, then you will require to do an abdominal scan to look for the womb, to look for the ovaries, whether there is any abnormalities present. Or sometimes doctors might ask me to do a pelvic ultrasound, because nowadays we find more and more women are very obese. And the scanning doesn't give us full information. So when we do a vaginal scan, then it gives us more information as well. So that's the reason we do a vaginal scan. Or sometimes we do a blood test to confirm is your hemoglobin, do you carry enough blood in your system, or there's a full blood count. Or sometimes we look for any bleeding disorders, or we look at your iron levels, or sometimes you need to do a blood test to look at your hormone levels and thyroid, whether it functions normally or not. So we do a medical therapy first test. If you find you have an abnormal heavy periods, sometimes you use medication. Most often you use medication to solve your problem. Or sometimes you require an hysteroscope to use a telescope to look into the womb, see if there any abnormal growth. That's like a decap procedure that can be done. Then we can send you back home. Or sometimes you need to do a biopsy of the lining of the womb. So that we do it as an outpatient, or as an inpatient, we can get it done. Or we can require laparoscopic surgery. That as an inpatient can be done. So in summary, abnormal heavy menstrual bleeding is a common problem in women. We need to seek medical health practitioners for advice and guidance. You need to identify what is the cause of bleeding. If you're feeling tired and lethargic, it requires to exclude iron deficiency, underlying iron deficiency, because iron deficiency is pretty common in women in reproductive age group. 60 to 70% of women are iron deficient, which can be addressed and which can be corrected. So even though your blood levels is okay, we can need to assess. So for medical therapy, or if medical therapy fails, your blood levels is okay, we can need to assess. So for medical therapy, or if medical therapy fails,
That's very, very interesting.
Thank you.
I'm gonna head over to the Q&A right now. We have a few questions actually, doctor. Mostly it's about menstruation related. So question number 1 from Sophia. Why do women always bloat during period or before period? We tend to feel more
bloated.
Yeah.
Okay. Good question. Every other person asks me the same question. You know, as I mentioned, that most of the time the cycles are controlled by hormones coming from the pituitary. Those hormones are called follicle stimulating hormone and luteinizing hormone. Those hormonal activities are peak. So when the hormones are steroid-based hormones, it has the ability to retain your water in your cells. So that's the reason the water retention causes this bloated feeling. You wait until your periods. Once you begin to have your normal flow, you feel very lighter and you feel comfortable. And see, because the level of hormones goes down, so that's the reason your water retention is lost and you feel very comfortable after that. So that is quite natural to feel in that manner. If you measure your body weight also, it changes over time. It's not same.
That's correct. So we also have another question. Question 2 from Eunice. When is it a good time or a suitable time to visit an OBGYN, and also what can they expect from the assessment?
It depends on what is the purpose. Actually, if you look at a reproductive health, most of the time, we advise we need to have a proper assessment done. So ideally will be good is soon after periods, soon after menstrual periods, you can go and consult them, and you can have a proper assessment done, examination assessment, proper pelvic assessment examination done, and if require any further investigations can be done soon after menstrual periods.
How often do we actually need to visit?
Visit. Okay, because most often the women are, even the, because nowadays we look at generally all over the world, the women find a partner in late 30s or early 30s or late 30s, and they plan to start family only after late 30s or early 40s, but too late. If you look at generally, gone are the days women find a partner at 18, 19, get married, and have children at 20, 25. But nowadays it's not normal. So by 25 you complete family, by 35, by 40 you're grandmother already. but now it's very different. So you find partner only at 35, 30, you start your family. So at that time it's a little bit difficult because you know what? The underlying problem is women are born with eggs. Eggs are not produced, reproduced. Like for example, sperms are reproduced every 64 days once. But women are born with eggs, and those eggs, like 500,000 eggs, which is you're born with, and you're being utilized over your entire reproductive phase. That means, right, you start menstruating from the age of 11, 12 years old, and you become menopause at the age of 45, 50 years old. So at that during that average duration, every month you have menstrual cycles, depends on how much egg you use up. So based on that, only you need to assess. So the moment you get married, you find a partner, planning to start a family, it's good to have an assessment done and check on that.
What is your recommended age? What do you recommend, like the age for women? As like, because we have eggs, so how do we? What's the recommended age first?
Normally we say there's no absolute formula for that. Okay, we advise to seek consultation with a healthcare professional if you get married, find a partner, you trying to conceive, if more than two years, even after unprotected sexual intercourse, you don't conceive, then you seek a consultation with a professional. But if you're older age group of women, you're married age of 30, 35, I see the moment you get married, you seek a consultation with a healthcare professional, because we need to assess properly to check whether the egg reserves are adequate enough, or do you have any problems, so that we can address it earlier. And if you require any help, we can start it early. If not, we can wait and start treatment when it's important.
We have another question from Jessica.
Okay.
Why do women experience stomach cramps, back pain, and headache during periods?
Periods. Okay. As I mentioned earlier, it's a hormonal build-up. Is building up to the peak. So the cramps as such, abdominal cramps women do per se, is because of water retention, number one. Number two, there's a subtle changes taking place in the lining of the womb, where beginning itself to break down and shedding of the endometrium lining of the uterus. That has some chemicals like prostaglandins and all those thromboxanes. All those things begin to happen. That accumulates in the basal layer of the endometrium, which causes cramps. So that the woman begins to shed, she will have cramps, and that's why she required to take some analgesics, and that will help her to ease off the pain.
Last question. We actually have from this girl named Jess. Does it mean people with iron deficiency, are they prone to abnormal bleeding?
Generally, it is not abnormal bleeding leading to iron deficiency. See, normally the iron is absorbed and stored in your system. Hopefully, it was beneficial, because most often healthy women, they think that they're healthy. But if you look at the iron stock, they are not. Okay, for example, if you look at all the women who come for a health checkup and do for pregnancy, they come early. They look at the blood count. The blood count is absolutely normal. If you look at hemoglobin of 10 or 11, they are not anemic actually. But if all this group of women 60 to 70% of them are iron deficient, because during pregnancy, the iron is absorbed more because the growing baby puts extra demand to take this iron, number one. Number two, her body, the woman's body itself, has to produce more red blood cells to prepare herself for childbirth. So that puts more demand of iron as well. So generally put double whammy, there's over demand, but your body is already lack of deposit of iron in your system. So that leads to chronic iron deficiency. And by the time you deliver, you are not anemic, but when you look at the blood test right before your delivery, you become anemic and you face issues because of that. So iron supplementation is very essential, but sometimes there's a common misbelief that taking iron supplementation makes the baby bigger size. No, actually, it's not true. It's not true. It is iron supplementation is iron replacement which we need to do.
Moving on, we actually have more questions that actually came through. We have one question from Alia.
Okay.
Why do women crave for food prior to period?
Wow. Yeah. Okay. That's as I said. Okay, it's a crescendo effect. No? Your peak of hormones is very much as a lot of water retention. There's some amount of subtle changes taking place in the brain, your emotional component of it. So that causes craving, more craving for food or some sweet food or some, it depends on the individual. Every individual is different. It's not the same. Like pregnancy, you know, right before, some have aversions to food, some have cravings for the food. So that is the reason. But technically, it is not exactly the same for every individual. It's different.
Are there any don't eat type of food during pregnancy that we have to avoid?
Okay, generally as a rule of thumb, we need to practice healthy eating habits. For example, I always like to say this: when you go to a restaurant, everybody is eating. You go and look at the plates. Hardly 90% of the population don't eat vegetables. Okay, okay. So that's true. That's true. That's the reason the amount of obesity in Malaysia is excessive. More than 30 to 40% of the population is obese. So ideally speaking, we need to follow the quarter and half portion. That means quarter plate have carbohydrate, that means rice, and quarter plate of proteins or meat, which is replaced, and 50% of your plate should have vegetables and fruits to replace your meal. So as long as you're able to follow that, is okay. Don't excessively eat carbs or excessive amount of proteins, not too much of carbonated drinks. And if you follow the same principle, avoid fried stuffs, calorie-rich food, that means increase in fat content or creaminess, and you need to avoid that. So as long as you can exercise and maintain your body weight, normally you feel a lot better.
All right, that's very interesting. Doctor, we actually have a question from Bhavani.
Yes.
She asked, are blood clot normal during first day of period?
Yes, Bhavani, the blood clot, it is, you need to look at a little bit of small clots is okay, it's acceptable. But if you have severe cramps, passing on big clots, like for example, if you are more than 20 cent Malaysian coin or a 50 cent Malaysian coin, it's not normal. You need to seek your healthcare professional and consultant, and they'll be able to guide you through. Sometimes can be normal, but after excluding any underlying problem, then only you can see it's normal or abnormal. But if you're passing too much of clots and experiencing severe pain, then I advise you or recommend you to see a healthcare professional for proper assessment.
We also have one question that says, what is the normal count for iron storage in the body?
In the body, okay, excellent, very beautiful question, very important question. People sometimes, I'm sad that not majority of the healthcare professionals follow that. Okay, serum ferritin level is a only reliable indicator. Sometimes it can be elevated if you have some infection or some falsely elevated. So we need to interpret it a little bit technically, we have to be very sure about interpreting serum ferritin levels. If anybody considers ferritin level less than 20 micrograms is considered severe iron deficiency. Severe iron deficiency. We expect the value should be about 70 or 80 your iron stores to have adequate iron stores. If you have around 30 to 40 your iron depleted stores, but you're okay, you won't be anemic. If you're sometimes your hemoglobin, don't look at your hemoglobin. Hemoglobin will be 10 and 11, but your iron levels or ferritin levels will be less than 20. So make sure that should alert you. In my experience, women who are having heavy menstrual bleeding, if you look at your iron levels, is less than 4, less than 5. Ferritin level is less than 8. Most often it's less than 8. A woman experiencing heavy menstrual bleeding and iron deficiency is very common.
We actually have a question from Jamie.
Yes.
Does menstrual cycle get shorter with age?
With age, hi Jamie. Okay, the menstrual cycles are very variable. The cycle length. I mentioned the cycle length within 28 to 38 days is normal. We should expect to be normal. But when you look at your adolescent, in the beginning phase of your menstrual cycles, like in the adolescent phase, your cycles will be irregular. That means you can have a shorter cycles, which is not normal because that shows you are not ovulating. Okay, and during your in a reproductive age, your cycles will be regular, and right before menopause, like before after age of 40, before menopause means 43, 44, your cycles can jump and be shorter or longer, which is abnormal. But subsequently, you should return back to normal 20. That's the reason I said that all the medical experts have come to agreement that a woman experiencing cycles between 24 to 38 days is normal. I hope I answered the question.
Yeah, we hope that we answer your question, Jamie. And everyone else, we'll have one more. We have another question from Amanda. Amanda asked, is it encouraged to exercise during period?
Okay, I will leave it to every individual to determine themselves. That will be the best answer. There's no hard and fast rule. It depends on the individuals and how everybody views. If you feel very tired, lethargic, and you're unable to go, don't push yourself. Leave it be. Take rest. It's okay. But if you are very energetic, you want to sweat it out, it brings you feeling good, feel good. You know, when you exercise, it secretes endorphins in your brain and make you feel good. If you feel that you want to do it, give it a try. Don't push yourself. Use your own limit. You are the best judge for yourself. I can't judge for you what you want, how it's going to be. So you can exercise, nothing wrong. Go. Don't push yourself. If you want, you can go for a walk, sweat out a little bit. That should help you.
That's very interesting. So light exercises, moderate high intensity. So depends on the personal
preferences.
Risha, we noticed that you actually raised your hand. Do you have any question? Please do type down in the Zoom chat and we will get back to you once we get it. So doctor, I actually have I want to know more about your opinions.
Okay.
Are there any differences between women using sanitary pads, tampons, or menstrual cup? And does it actually affect the vaginal area or is it safe? Yeah,
okay, that is a common question. We come across some common problems as a gynecology we face. It entirely depends on individual personal preferences and personal choice, how you are being brought up, and your values, what you are. We as the Asian community, we are a very conservative community, and we don't like to put anything inside the vagina, most of it. So that's the reason from young, most of the population, whatever race you are, very conservative, and we use sanitary pads more often. So sanitary pads comes in different sizes because it is manufactured to absorb what is required of. So that's the reason maternity pads after childbirth we use thick pads to absorb more blood, but whereas a normal sanitary pad is different. So that goes. And most often nowadays we see women because of vaginal discharge. They don't want to get vaginal discharge, so most often they use sanitary panty liners. Yeah, you're right. They constantly use panty liners. That causes skin eczema, skin excoriation, the reaction in your vulva vaginal area. So that causes excessive reaction and skin changes and dermatitis in the skin. So if you excessive use of pad or panty liners can land up in that problem. So to overcome that, sometimes people use tampon. Okay? Tampon is very popular in the Western world, and they leave a piece of tampon and attached to a string inside the vagina. Because most often women are not sexually active, so in Asian population, they very poor intact. They don't like to use tampon. So majority of population don't use it. Very few do use it. But what is the problem with use of tampons is you place it in the vagina, and you shouldn't forget to remove it. If you forget to remove it, what is going to happen is going to come across worse consequences. What happens is the blood is soaked in the tampon and stays in it. Vagina is a very, very common area for bacteria to grow. And the blood and the bacteria is a good combination for bacteria to grow. Bacteria likes to grow in the blood. So when it undergoes changes, it grows. This bacteria has nowhere else to go. It goes into your body, it causes toxic shock syndrome, and people do die because of that. So you have to be very, very careful. Make sure you use a tampon. You need to remove it properly. If not, you can face consequences. Menstrual cup is a cup you place inside the vagina. Once the menstrual period is over, you need to remove it and wash it and put it. It's very cumbersome and it's not very popular in this part of the
Yeah, that's very interesting about the panty liners. We actually have a rumor question.
Oh,
yeah, like a myth there. Rumor from Amanda. Amanda,
okay.
Thank you for your question. Rumors always mention
okay.
sweet food consumption during period does not cause weight gain. Is that true?
Okay, I cannot. Okay, first and foremost, you must understand. You can't when you look at nutrition and food. You don't look at the nutrition. Okay, doctor, they say for example, I don't consume food. I don't eat food at all. Okay, then say, how come you're not losing weight? We ask. I said, doctor, I like to eat chocolate. A small piece of chocolate, and small piece of cake. But we can't be, even though the quantity you eat is lesser, but it is not equals to when you quantify the nutrition. It's two different categories. Nutrition means the amount of calorie it contains. It should contain vitamins and minerals as well. So most often this calorie-rich food has calories, but not vitamins in it. So that's the reason the sweet food doesn't cause weight gain. I don't look at the sweet food is calorie rich. So like for example, a piece of a small cup of tablespoon of sugar has 20 kilocalories of carbohydrate. Whereas if 1 cup of rice has around 200 kilocalories. For example, a small piece of cake, a cheesecake, which has cheese, butter, fat, and cream in it. So a small piece of cake has 700 kilocalories. So which one is equal? It's a small, big cup of rice will give you less calories, but a small piece of cake can give you a big calories. So a large amount of calories. So you have to be very careful what you're doing. It's not the sweet. It is this amount of calories. Learn to look at calories. Very, very important.
Moving on, we have a question from Hess. If I had a cycle of prolonged period that lasted for 20 days, is it normal to miss my next cycle?
Absolutely has. Okay, it is quite natural. That's what we call is ovulatory dysfunction. If your cycles and your emotions are normal, you tend to ovulate every 28 to 30 days once. That means your periods will be coming every 28 to 30 days. For example, if you're going to sit for an exam or very stressful with work, you won't get your period in 28 to 30 days. So your period will be delayed. That means you won't get periods for next 40 days, 50 days. That means your cycle jumps. Then after that, after 40 days later, you will get your periods. Your periods will be very prolonged. It means 20 days you tend to bleed because you don't have that ovulatory hormone progesterone to stabilize your image, which causes prolonged bleeding. So Then subsequently your cycles might return to normal or might jump for a little longer and eventually get in place. If you gain too much of weight, very often you face this problem. So your body weight is very, very essential to maintain your cycle regularity.
We have a last question from Joanne.
Yes, Joanne.
Is there any side effects by taking medication related to menstrual problem? Like, for example, painkillers for period pain or pills to regulate period. What is your opinion?
Okay. First and foremost, all this medication is not permanent. What we recommend you to take. Most often, only less than 5 to 10% of population do take the medication. So this all is a temporary. Most often it's a temporary. All these medications are temporary. So it doesn't harm very long. So if you take for 1 or 2 months, then once you feel comfortable, or 3 months maximum, then you try to regularize by your own, maintaining your body weight and other things, you'll be okay.
You'll be okay. Okay, so we have reached the end of our session. I would like to thank Dr. Thani for joining us today and explain to us more information about our menstrual period, or what we can say, time of the month. Also, we'd like to thank you, y'all, for joining us in Zoom today to understand more. It's very, very insightful information. Doctor On Call is always here for you. So please head over to droncall.com.my if you want to know more information. Goodbye and have a nice day ahead.
Thank you. Take care.